It is my immense pleasure and my honor to welcome all of you here, all the dignitaries who have come far away, especially to make this event a very successful.
Right, I would love to introduce to you another eminent speaker, Dr. Rishi Sharma. Dr. Rishi Sharma, MD, is a graduate of the S.K.H Medical College. Jaipur is a pioneering figure in cancer immunotherapy. His groundbreaking research on non-PDL1 criteria led to the development of the Candrol line of treatment without psychotoxic effects in the body. Wow. Dr. Rishi Sharma will be sharing his research in India as emerging medical tourism, sport for cancer, immunotherapy for the reason of its well-researched technology, highlighting highly intellectual doctors, affordability, result output, and infrastructure.
Jai Siya Ram. Ladies and gentlemen, esteemed colleagues and distinguished guests, it is with great honor and humility that I stand before you today as a cancer physician. In the pursuit of healing, I have dedicated my life to the relentless fight against this formidable adversary. Within the halls of Oxford University, renowned for its commitment to excellence and dedication for the latest innovations, I'm inspired by the opportunity to share our collective journey towards conquering cancers. Together, through collaboration, compassion, and cutting edge research, let us strive to transform the landscape of oncology and bring hope to those affected by this disease. I do not want to go very technical. I know there is a time foundations as well. So I will just touch the superficial, okay? Otherwise, it will be very technical for you all to understand. Immunotherapy represents a revolutionary approach to treat cancers by harnessing the power of immune system to target and destroy cancer cells. Unlike conventional treatments like chemotherapy and radiation, which directly target cancer cells, immunotherapy works by bolstering the body's own defense mechanisms to recognize and attack cancer cells. So basically here we want to say that we want to do something for the cancer patient so that his or her own body recognizes his or her own cancer and start developing a natural defenses against it. And this is more safer. One of the exciting aspects of immunotherapy is its potential for long-term remissions and fewer side effects as compared to conventional treatments. Now, I really hope that you know the side effects of chemotherapy and radiation oncology. So when we talk about immunotherapy, we get very low profile side effects in that, and people are able to bear it very easily. So we don't have a very massive profile of side effects in that. So clinically, we see that we observe only two kinds of side effects. Number one is sugar fluctuation in the body after the medications. And number two is slight sleepiness, which is induced in the patients. But these are very nominal side effects, can be managed very easily. It has shown remarkable success in treating various kinds of cancers, including melanomas, lung cancers, lymphomas, leukemias, gallbladder, rectum, breast cancers, and various other cancers as well. Now, there are different kinds of immunotherapies, including immune checkpoint inhibitors, CAR T cell therapy, and cancer vaccines. Now, when we say cancer vaccines, we mean that we have two kinds of approaches. Number one, either we want to do something for the prophylaxis, that is to prevent cancer from coming into the body. And number two, when cancer has been diagnosed, we can do on therapeutic approaches. So cancer vaccines works in prevention of cancers, and therapeutic medicine works in controlling cancer from growing further. We give medication through oral routes or IV routes, each tailored to activate the immune system in different ways to combat the cancer disease. As our understanding towards medicine is increasing multifolds, we now have understood that advanced stages cannot be managed with single system of medicine. The combination modality is the new in today's oncology. We call it comprehensive oncology or integrated approach to get better outcomes in palliation and to overcome repeat surgeries and chemotherapy resistance. Now, one thing here I want to highlight, you might have seen that people go on taking chemotherapies repeatedly. 1 cycle to 6 cycles, then it becomes 9, and then it becomes to 42 cycles approx. Like it can go like that level. So when we have studied that when more than 9 cycles are administered to the patient usually becomes chemotherapy resistant. So that particular drug does not occur any further. So that state is known as a state of resistance, and there we need to combine modalities together in order to get a very better outcomes. The estimated number of cases of cancers in India for the year 2023 was estimated to be about 14,61,427. It's a havoc over there. If we calculate the crude rate, it comes out to be 100.4 per lakh. That means a country like that of India, 1 in 9 people is most likely to develop cancer during his or her lifetime. In India, breast cancer and lung cancers are the commonest form of cancers among women and men respectively. While immunotherapy has transformed the landscape of cancer treatment, ongoing research continues to refine and expand its application, offering hope to patients who previously had a similar kind of cancer treatment and have experienced other conventional options. As we conclude our discussion on immunotherapy, here at Oxford's, let us applaud not just the science, but the countless lives touched and transformed by this groundbreaking treatment and technology. The resounding applause echoes the tireless dedication of researchers, the bravery of patients, and the hope ignited by innovative therapies like that of immunotherapy. Let us continue to clap, not just the celebration, but in solidarity as we strive to make immunotherapy accessible to all who need it, and to pave the way for the future where cancer is no longer a formidable foe. Thank you, and let the applause resonate with the promise to progress and healing in the halls and corridors of this beautiful university. Thank you so much. That was Dr. Rishi Sharma.
Okay, so I guess we can take some questions now for Dr. Rishi if you have any questions for him.
Yes.
How do you prevent yourself from getting cancer?
Well, first of all, we have developed many kind of platforms to conduct the genetic counselings among the families, especially those families are being selected whose parents and it runs into the bloodlines of those families. So if we found that certain genetic markers and studies are showing that the offsprings may develop cancer during his or her lifetime, then appropriate prophylaxis measures can be taken. And of course, we have HPV vaccines. Have you heard about that? Cervix cancer vaccine? It is in India available. So 3 shots has to be taken after 13 years of age, especially for the girls, before menarche. So first dose should go before menarche, and it can be followed well with second dose and third dose. So these are just few things which we need to keep in mind if we want to prevent cancer from coming. So even if we are giving a HPV vaccine to the patient, so cervic cancer vaccine to the patient, then she develops 70% immunity against it. Yes, please.
How would you treat people who have breast cancer, for instance? I have um, uh, a family member, sadly, that has it. How would you treat?
Now, breast cancer is a very good responding cancer. So, even if somebody has developed breast cancer, which is a very commonest form of cancer, no need to panic. First of all, the confirmation diagnosis has to be done, biopsy is to be done, number one, mammograms have to be done, and of course, this is a very important question. Every lady on approaching towards menopause, she should definitely conduct a mammogram every year, right? Any sort of lump, any sort of tumor is not to be neglected. For this, you need not to even go to the lab. You can perform your own breast exam just by palpating. Palpate your armpit, palpate your breast, nipple area, so that if you feel anything hard, if you feel anything painful lump is there, get it reported immediately. So breast cancer management is going to be very easy. The biopsy will be done. After that, if doctor thinks that surgery is the option over here, it can be performed. What I personally feel that instead of going for lumpectomy, that is conservative surgery. Suppose if a young girl is there who want to conserve the breast, so she tells to the doctor that no doctor, I don't want to remove my complete breast. I want to have my breast, just remove the lump. This is not a good thing. We have seen failures in that. So even if you take a wider excision, that is, even if the surgeon tries to remove the lump altogether, he cannot see the micro cancer cell which remains in the body and which might again germinate into a newer tumor. So radical mastectomy, that is complete removal, is more recommended. Followed by medicine, immunotherapy and chemotherapy. Did I answer you?
So immuno,
Yes.
and conventional.
Yes, chemotherapy. So, with the help of immunotherapy, you will get a strength to fight with your own disease. And chemotherapy will reduce acute exacerbation of the symptoms. Right? So, chemotherapy is something like a bomb. You just throw a bomb on the border, everything is killed. Right? Immunotherapy is intelligent. It can flag cancer cells and the normal cell. So we don't want to touch normal cell. We want to touch and target only cancer cells, right? So that is the intelligence of immunotherapy, and that's why it is a newer innovation.
So in terms of using immunotherapy to treat breast cancer, how much of cases have you experienced, or not experienced rather, you've dealt with that have, proved, positive?
65 to 75%, very high figure. So need not to worry for that. Even one-time recurrence of breast cancer has a very good survival rate. Normally, I do not say this to the patients because one-time recurrence means that your vitality has completely been distorted and you definitely needs combination modality. You understood what is combination modality? Combination modality means taking more than one medication at the same time, right? In order to get one of the finest defenses to the patients so that they do not develop disease again.
Thank you very much.
Thank you so much. Please, ma'am.
How you do immunotherapy in case of breast cancer?
So,
Give an example.
So immunotherapy is a very broad topic. Immunotherapy is done many different kinds of immunotherapies are there. Some immunotherapies are PDL1 based immunotherapies. PDL1 is a test. I will explain you in a simpler language. If patient is PDL1 positive, particular sort of drugs can be given to the patient. These are medicines only, right? So medication administration can be oral, it can be IV. Both forms are available. Sometimes if we want to do dendritic cell therapy, which is a IV therapy, I did not want to touch this topic actually. Dendritic cell therapy may you need to take out your own blood. We take your own blood, we concentrate the WBCs, which are the army cells of your body, and we re-inject into yourself. Yes, ma'am.
So as a common person, if my grandparents had a certain type of cancer, and I would like to kind of make myself immune to that, and I come to you, and you said that you will do some profile checks, and so irrespective of, like, maybe you will figure out how much chances a person has to get the particular disease. Is it generally any medication to prevent the upcoming cancer? Because we hear stories, uh, before 15 days everything was fine, they just discovered, and it's in stage 2 3, because normally the person is healthy, and that can happen to anybody. So I want to prevent that situation when a person is healthy. How do we do that?
So first of all, there are certain genetic tests which, yes, there it is true that it can be conducted to find out the possibility in you how to develop. Means if you have a chance of developing cancer in future. Have you heard about Angelina Jolie removed her breast? Did you hear that? Yeah. She came out to be highly prone target to develop cancer. So surgeons recommended that both breasts should be removed, including ovary. Right? So these are surgical prophylaxis. This is known as surgical prophylaxis. Now, suppose if a patient doesn't want to go for surgery because she's absolutely fine right now, right? There is no symptom of cancer. Instead of that, doctor recommended her to undergo a surgery in order so that cancer does not come into the body. But I don't think people think that way, right? So there are medications which can do this job. There are prophylaxis treatment, oral treatments, IV treatments, which can be done in order to provide you a very good strength and immunity. Geeta
So
Didi.
in India, we have this Ayurvedic treatments.
We have.
I mean, we have in India, but the thing is, are you open to those Ayurvedic treatments?
Yes, we are. See, basically, if we see that the case has gone beyond stage 3B, we welcome all modalities to come together. No system of medicine is complete in itself, and we can't boast one system of medicine that I am big and you are inferior or we are superior. No, in medicine, we do not talk like this. Once we come onto a same platform, once we agree that, okay, Ayurveda can be given to the patient along with allopathy or homeopathy, then there is no contradiction. We have not seen any sort of medical contradiction even if patient undergoes Ayurveda treatment along with the immunotherapy. We don't have any contradiction seen. So patient can take. But here I want to say one thing. Supplementary medication and complementary medication cannot replace mainstream medicine. Right? So mainstream medicine plus add-on treatments. It is cherished. And recently I in one of the conference I was talking about spiritualism. I was very carefully listening to what you said. I very strongly believe in that. People, those who live happily in their lives, those who are spiritual. I'm not talking about religion here, but those who are spiritual, they have less chance of developing cancer. It is proven study by Cambridge.
And meditation with medicine.
Of course, of
Do
course.
non-professions?
In every manner, if we can reduce the inflammatory process in the body, then we are at lower risk of developing cancer in the lifetime.
Thank you. Thank you.
My pleasure. Anybody else?
Thank you.
Thank you so much. It was a pleasure talking to you.
So the first person that we would like to honour is Rishi Sharma, Dr. Rishi Sharma.